Good afternoon. Thank you so much for joining us. My name's Marceline White, and I'm the Executive Director of the Maryland Consumer Rights Coalition, MCRC. MCRC advances economic rights and financial inclusion through research, education, advocacy, and direct service. We're also part of the End Medical Debt Maryland Coalition, which you'll hear about in a little bit. We're here today to talk about the problem of medical debt in Maryland and to talk about the Medical Debt Protection Act and why it is so needed and why it's so important today to meet this moment. I just want to give you a little bit of context for the issues of medical debt, both before the crisis and today. Before the crisis, a United Way study found that 39% of Maryland families were struggling economically. That means they were having problems day to day, week to week, meeting their basic needs. At the same time, we know that medical debt is a huge issue for a number of Maryland families, particularly in low income communities and in communities of color. Hospital care, in particular, is the largest problem that many people face with medical debt. And hospital debt and medical debt are a leading cause of bankruptcy or a contributor to bankruptcy for Maryland families and across the nation. Yet, despite this, between 2008 and 2018, Maryland hospitals filed 145,746 lawsuits against former patients to collect on hospital medical debt. The median amount owed was $944. So they sued many of these people for less than $1,000. Now, today, this bill is even more important because up to 12 million people nationally have lost employer-sponsored healthcare coverage because of the pandemic and the economic recession. MCRC commissioned a poll of Maryland voters in October 2020, and we found a number of alarming trends, including clear evidence that medical debt was disproportionately harming certain communities. Some of our findings include 12% of Marylanders indicate that they or someone in their household has a medical debt that they are unable to meet. Now, of that, 3 times as many African American households are struggling to pay medical debt as white households. 45% of African American households would have to use a credit card or would be unable to pay a $500 medical bill, compared to 18% of white households. Hospitals say they provide financial assistance policies, and this legislation is not needed. But 29% of the people that we polled were unaware of these policies. And of those, 50% of African Americans polled were unaware of the financial assistance policies hospitals have, even though African American households are more aggressively pursued for medical debt. The Medical Debt Protection Act meets this moment. It provides important protections for economically struggling households, and it ensures that no one would lose their home, their wages, or their savings because they went to a hospital and sought medical care. Now, I want to take a minute and introduce Malcolm Heflin. He is the Baltimore City lead organizer for Progressive Maryland, and he's a leader of the End Medical Debt Maryland Coalition. Welcome, Malcolm.
Hi, my name is Malcolm Heflin, and I'm an organizer with Progressive Maryland, and I'm also a proud member of the In Medical Debts Maryland Coalition. As of today, our coalition is comprised of 48 member organizations and growing every day. And as you can see here, our coalition represents organizations across the spectrum here. We have union partners, we have community partners, we have economic justice partners as well, and we all come together for one purpose and one uncompromising purpose: to end medical debt in Maryland. Period. That we all know, because of some of the many of the facts that you've heard, we know that the only way that we will be able to find justice for many of the Marylanders in frontline communities and many working Marylanders is to end the practice of medical debt totally. So our advocacy around this bill just represents a first step and an opening down payment for what we're going to be, what our goals are and what we intend to do. Like I said, there is a great need for reform now. There are numbers that you see all over the spectrum about this, but there is a sizable portion of people who are going to be heading out of this pandemic with long-term medical issues. Chronic fatigue syndrome is one that we're already seeing a lot with people who are or grappling with COVID and recovering from it. So we're going to have a greater need for healthcare, and there'll be more and more people and more Marylanders that are going to be accessing healthcare over the years. And we can't have a healthcare system that the one we have now going forward, because there will be so many more people who will find themselves in economic hardship for something that they can't help, for accessing healthcare. So our coalition is dedicated in ending this practice, because we all see the need to end medical debt here in Maryland. And I'm looking forward to continuing this fight today and into the future. So thank you very much for the time. And with that, I'm going to pass it back to Marceline.
Thank you so much, Malcolm. Great points about the need to expand and meet this moment with all of the challenges we're seeing with COVID patients. As I mentioned, hospitals, when they sue patients for medical debt, they can put a lien on your home. Over a 10-year period, hospitals placed liens on 4,432 homes and cars. I am so pleased today to welcome and introduce Nick Mostris, who's going to tell his family story and experience with medical debt. Welcome, Nick.
Thank you, Marceline. Good afternoon, everyone. And thank you for giving me the chance to explain why it's so important to pass as a Medical Debt Protection Act. My name is Nick Mostris, and I'm a lifelong resident of Harford County. I have personally experienced the devastating impact of medical debt can have on just one family. I wish that my family's story was unique, but unfortunately, we are like so many others that have been failed by our medical system. I lost both of my parents to severe medical conditions. I love and miss them every day. And although both of them have passed on, I'm here to fight for justice for families like mine, still struggling under the burden of medical debt. My father was diagnosed with neurosarcoidosis in 1992, a rare and chronic disease. He endured treatment for over 15 years at various hospitals, including Folsom General, which is now Upper Chesapeake, and Johns Hopkins. My mother raised me and my two brothers while working full time, sometimes even working two jobs, and managing my father's treatments on top of all the medical bills. Even after we lost my father on June 15th, 2007, the bills continued to roll in. I saw the shock and the stress of the bills take over my mother's every waking moment. Debt collectors would call, write, and harass her daily. Then one of the hospitals, Folsom General, where my father had stayed for just 3 days, filed a lawsuit to place a lien against the home my parents worked so hard for. I remember my mom telling me she was too tired to fight the lien and to deal with all the stress of the lawyers and all the courtroom mess. Why is it right for hospitals to profit off of sick and dying people? Why is it right for well-funded hospitals to take families' homes? My mother worked literally her whole life to pay off medical debts until she just passed away 2 years ago, both from my father's health problems and of her own, like spinal injuries she developed from having to work two jobs. After she passed, my brothers and I began to sort through the estate. And by the time we finally heard back from an attorney overseeing the lien on our family's home, we were all completely shocked. The original bill was just $6,000. Now had become over $26,000 in interest, late fees, court fees, and attorney fees. The lien had almost quadrupled, leaving us no choice but to sell our family home with all the memories of our parents inside, just so that way we can move forward. The legislation heard today, the Medical Debt Protection Act, would have prevented Folsom General, now the University of Maryland, Upper Chesapeake, from placing the lien on our family's home. No family deserves to go through what we did, to lose their home because of medical debt. I urge legislators to support this legislation and to pass this much needed relief for those burdened by medical debt. Thank you.
Thank you, Nick, so much. Thank you for sharing your story. And I'm so sorry this happened to you and your family, but I'm so grateful that you've joined the struggle and fight to make sure this doesn't happen to any families in the future. Another thing that happens with hospital medical debt is that they can garnish wages for medical debt. Many of these wages are from lawsuits against their own workers, people working in the hospitals. In 10 years, 37,370 families had wages garnished. Here to discuss why the Medical Debt Protection Act is so important to workers is Donna Edwards, President of the Maryland State and District of Columbia AFL-CIO. Thank you and welcome, Donna.
Thank you. Good afternoon. Well, we in labor have always known, and now with the pandemic, everyone has seen that workers are the backbone of our entire economy. Workers of all sectors are essential to maintaining our way of life. Maryland's not-for-profit hospitals recorded a $5.6 billion profit over the 10-year period from 2009 to 2018, with demanding payment of nearly $269 million in medical debt from patients and working people. This is a mere 5% of their profits. Garnishing the wages of workers for medical debt starts a downward spiral of reduced income, pushing these workers into poverty, with some losing their homes, many losing their transportation that gets them to their job in the first place. This is not frivolous spending or taking on new credit for luxury items. This is debt because of medical needs that had to be met. They affect all of us, and no one is immune from an unforeseen medical emergency or procedure. Wage garnishment from medical debt forces workers into the position of having to decide between paying for household bills or getting necessary treatment to live. Maryland hospitals clearly have the resources available to stop the process of and practice of wage garnishment. They can provide the same level of care for everyone while simultaneously avoiding enacting financial harm on lower wage workers and all workers struggling to survive. Workers are essential to running Maryland. We need to give them the breathing room to take care of their health without having to worry about financial ruin and years of debt. Garnishing wages for the medical debt of workers is immoral, and we wholeheartedly support the Medical Debt Protection Act of 2021 being passed by our state legislature. We are very pleased to be part of this coalition and will work very hard to make sure that no Marylander loses their home, their car, and their quality of life because of medical debt. Thank you.
Thank you so much, Donna. Our essential workers are frontline day in and day out. We need to protect them, and passing this legislation and prohibiting wage garnishment for medical debt is one way to do that. We also know, as I mentioned, that medical debt has a disparate impact on communities of color, particularly Black and Brown communities that are living with the health disparities from legacies of structural racism. Here to talk about this issue and why this is so important, I'm pleased to welcome Reverend Kobe Little, Vice President of the Maryland NAACP.
Thank you, Marceline, and thank you to Delegate Lori Charkoudian for sponsoring House Bill 565, the Medical Debt Protection Act of 2021. I'm glad to be here today on behalf of the Maryland State Conference of the NAACP to offer our support for this legislation. Listen, you've already heard from the other speakers. This is certainly an economic security issue, but frankly, it's also a healthcare issue because the fear of medical debt and the impact of medical debt lawsuits often prevent people from getting the health care that they need. So we're glad to stand in support of this legislation to address the fact that medical debt and medical debt lawsuits exacerbate the economic insecurity experienced by many families in Maryland, particularly in the African-American community and other communities of color. We're also here to say that in a time when essential workers and students and families are doing everything they can just to stay afloat, we don't need to see hospitals, which continue to profit, suing citizens who are struggling to pay for food, pay for rent, pay their utilities, and to pay for health care. So we're delighted to join Maryland Consumer Rights Coalition, the AFL-CIO, Progressive Maryland, and so many other partners and friends like SEIU 1199 in support of this legislation. And we look forward to testifying today on behalf of the NAACP. Thank you.
Thank you so much. We're so glad to partner with you, Reverend Little. I do want to mention Delegate Charkoudian has to run to a subcommittee meeting, so she may be joining us very shortly. So a little out of order, but she may be joining us shortly to talk about why she sponsored this bill and what it will do. In the meantime, I want to talk a little bit about those who are coming and going forward with, I want to talk about those who are going to clinics and those who are in need of legal support and other support for these medical debt lawsuits for $1,000 and less. We're going to hear from Amy Hennon, Director of Advocacy and Financial Stabilization for the Maryland Volunteer Lawyer Service, and she sees many clients with medical debt issues. Thank you, Amy.
Thank you so much, Marceline. As Marceline said, my name is Amy Hennon. I'm the Director of Advocacy and Financial Stabilization at the Maryland Volunteer Lawyer Service, which is the oldest and largest provider of pro bono legal services in the state of Maryland. Every year we, in sort of a normal year, we assist approximately 400 folks at a clinic that we have in Baltimore City that is helping folks that are facing debt specifically. In addition, in the last 20 years, we've assisted more than 8,000 folks that are seeking help with bankruptcy. Of those 8,000 folks, approximately 30% of them indicated that medical debt was a significant factor in them pursuing bankruptcy. But if I think about the clinic that we hold in Baltimore City, I know that the folks that we see there they are low-income folks. Generally, they are folks that would definitely qualify for medical assistance. These are not folks that we should even see on this docket because they should have already been through hospitals' financial assistance programs. If they qualify for MVLS services, I promise you they qualify for hospital financial assistance. I want to talk about my client, Anne, who I think really exemplifies the kind of people that we meet. So she sought help from MVLS because she had a number of hospital bills, but her income was protected from, her income was Social Security. It comes from Social Security, which means that it's protected from garnishment from traditional creditors like hospital bills. And her financial status would have meant that she was a perfect participant for the financial assistance program. But when we spoke to her about it, she indicated that she had never heard about it. She didn't know anything about it. She didn't know that it was a possibility. She actually had, unfortunately, prioritized paying some of her hospital bills over some of her other bills that had put her in a really terrible financial situation. I want to contrast that with actually my own personal experience that I had with a hospital bill not that long ago. When I received the hospital bill, it was less than $1,000, but it was not something that I was going to be able to handle immediately. And I knew all of the different financial assistance programs that were available, and I knew what I could potentially do to assist myself with this bill. And so even though when I called the billing department at the hospital, it was a bit of a struggle to get the representative to kind of agree that yes, this was an option. The person kind of fought me initially, but because I was empowered and knew exactly what I was looking for and what was a possibility, it meant that I didn't have to fight to get any of this information, and I was able to get a resolution that worked really well for me. The hospitals might say that this is going to mean that people aren't going to pay their bills if they're not going to be garnished immediately, if they're not going to be able to sue them. But in fact, this is really not the case. This isn't going to outlaw debt collection. And in fact, people who really care about their credit scores and things like that are still going to pay their medical debts. And for Marylanders that are looking to enter into payment plans with the hospitals, the income-based repayment programs that are embedded within this bill are so critical, because it means that those folks will not be entering into payment plans that they can't afford, which we know that when someone is negotiating on their own behalf, they enter into payment plans that are far less affordable for them than if they had an attorney representing them. And we just know that not everybody who's negotiating with a hospital is going to have an attorney to represent them. So we urge the passage of this bill, and we thank you so much for having us a part of this.
Thank you so much, Amy. We really appreciate it, and thank you for all the work you do at the medical clinic. Not only will this bill help low-income clients who should know about the financial assistance policies but don't, but it's also going to affect and help working families who may have insurance but simply can't afford $1,000, $2,000, $3,000 payment out of pocket. Hospitals insist they bend over backwards to work with patients, yet as you'll hear from Ashley Esposito, that is not always the experience that many patients have when they're experiencing a medical debt problem. So I want to thank Ashley and welcome her to tell her personal story. Thank you.
Thank you so much, and thank you guys for doing this. I'm Ashley Esposito. I'm a Baltimore City resident. And my family, we're genetic carriers of a rare disease. So in order to have a baby that we can actually bring home, we have to go through IVF. Luckily, my previous job had medical insurance that covered 3 cycles of IVF 100%. So we paid $1,400 a month, and $900 of that was for the medical insurance through Cobra in order to like go through the IVF process and have a baby. So during our process, our debt is actually total of all of our co-pays, and anybody that's been through IVF knows that there's like a lot of appointments. So our debt is over $2,000 and $500 to store our embryos. When I first got a bill, I went to log into my chart and the bill was gone. So I just assumed that because my insurance coverage is 100%, it must have covered it. But shortly after that, and when I actually had my baby, I was hit with the bill. So I was at home taking care of him and started receiving collection calls, and immediately was treated like a criminal, or like I was trying to get over on somebody. But really it was, Hopkins having a billing issue or not, practicing some of these things that are actually included in the bill. So for us, it was really hard to focus on our priorities and recover from a C-section and all that, and stress about medical debt that we weren't even expecting. I mean, we're fortunate enough that we can actually cover it and pay it, but I can't imagine what other families are going through that have sought like fertility treatment but don't have the same insurance that we have. Yeah, like just overall, it's really hard for people to heal when they're drowning in medical debt. Like the only thing they should be focused on is taking care of themselves and their families. Especially like it hurts other areas that are unrelated to medical debt. I do have like a little guilt myself that I was so stressed dealing with all this and trying to fix this with Hopkins and running around it and wasting time that I could have been spending with my baby. So if people could support this bill, they're going to have a huge impact on families like mine.
Ashley, thank you so much for sharing your story. Again, this bill will affect families like Ashley's who may not be, who can cover a debt, but didn't know the medical billing process is very complicated. And as she mentioned, the mental stress and strain of having to deal with this as a new parent, on top of everything else, is often overwhelming for folks as well. And again, the Medical Debt Protection Act, HB 565, will include an income-based repayment plan so people can pay their bills in an affordable fashion. Not sure if Delegate Charkoudian is on yet. I know she's trying.
I'm here, Marceline, I'm here.
Okay, fantastic. I'm going to turn it over then and just take a minute and welcome Delegate Charkoudian to talk about the Medical Debt Protection Act and what it does. And thank you for bringing this bill forward this year.
Thank you, Marceline, and thank you to this extraordinary coalition. It is an honor to be bringing this bill forward. It is such a crucial piece of legislation, and I do apologize for popping on and off. I will be, I do have a subcommittee that's being heard happening at the same time, but in tracking this, I have heard some of the stories today. And thank you to the speaker who just spoke and all the courageous people coming forward, sharing the stories about how their lives have just been absolutely upended, how they faced financial ruin at some of the hardest times in their lives because of their health, because of a loved one's health. And I think that we have a basic understanding. We may have lots of different ideas about, in our state about policy and what policy ideas are right, but there's a basic understanding that people should not become bankrupt because they got sick. That people should not, when they're suffering and healing from an illness, should not also have the added stress of nonstop calls with bill collectors and harassments from bill collectors and being dragged into court. I think that that's something I think that we can all agree on, and that's part of what this bill addresses. The other thing I think we can all agree on, especially right now, this bill was important to me last year. I had a really good understanding of why it was important, and then the pandemic hit, and I had, was dealing with constituents who were afraid to go to the hospital when they needed to go to the hospital, when public health officials were saying you have to go to the hospital, and they were afraid of medical debt. Now, whether they would have ended up with it or not is irrelevant, because if the word on the street is you're going to be saddled with debt, you're going to be dragged into court, you're going to have debt collectors going after you. If that word is out there and people aren't seeking the care they need, then we have an added on top of our pandemic, added on top of public health crises, we have an additional public health situation. And that's what this is dealing with. This bill, considers, we've worked very closely with the Attorney General's the Attorney General's office. This bill considers all of the federal and state laws, all of what is unique about this state, and it allows hospitals certainly to continue to collect on their bills, but it sets guardrails on how that happens. It sets guardrails so that people are not dragged into court for $250, having to miss work. And have all of that stress. It sets guardrails so people have a shot at paying bills back through a reasonable payment plan before things are turned over to debt collectors. It sets guardrails to make sure that people have been informed about the opportunities to get financial assistance before they end up in some sort of a debt collection. And so what we're doing here, what we have here is really a common sense balance of ensuring the ongoing stability of hospital financial situations, the total cost of care model, all of that, and ensuring that our patients are taken care of both when they're in the hospital by phenomenal hospital staff, by incredible nurses and doctors and other care providers, and that they're taken care of when they leave that hospital, that they leave that hospital in a way that is sane and stable for their family as it relates to the financial situation. Thrilled to be bringing this in. Thank you so much to all the people on this call who have worked so hard to help me build a really good piece of policy, and also all of the organizing that you're doing. And sorry, I'm going to jump off and get back to a subcommittee. And thank you again.
Thank you so much, Delegate Charkoudian, for your leadership and all of your work on this bill. She mentioned the great doctors and nurses who care for patients. It's now my honor to introduce Kim Walsh, who is a nurse who lives in Prince George's County, who's going to discuss the importance of this bill from her perspective.
Great, thank you. My name is Kim Walsh. I'm a registered nurse working with older adults in an acute care unit hospital. And I'm a resident of Prince George's County, a proud member of National Nurses United, which is the largest union of registered nurses in the country. Every day I work with elderly patients, and unfortunately too many patients are worried about medical debt and lawsuits by hospitals. Too many people delay and avoid necessary care because they worry about that medical debt. And during this pandemic time, there's a great loss of jobs, which means that many Marylanders are uninsured or underinsured. When they come to the hospital, it's due to a serious illness. It's because it can't be delayed or stalled. The treatments that they need must happen. And it requires days of testing, monitoring, stabilizing them prior to discharge. to either a rehab or a nursing home or back home with a home health aide or family support. In deferring healthcare for acute care needs, it can also lead to complications, more severe illness, other bad health outcomes, and longer stays. Patients really need healthcare, but they also need protection from the predatory bill collectors. The COVID-19 pandemic, it's really driven home the understanding that avoiding necessary care, it puts lives at risk and it can lead to the spread of more disease. Nurses believe that healthcare is a human right and that everyone has a right to healthcare. Everyone deserves a quality care and without fearing bankruptcy, homelessness, or other financial trauma and stress. And right now we have a crisis in our state. Over a 10-year period, more than 145,000 Marylanders were sued by hospitals for medical debt. And the stories you're hearing today are just a tiny fraction of what I hear at the bedside from Marylanders suffering from the unfair practices of hospital corporations. Maryland patients, they need the General Assembly to step up and step forward. Legislators must address the medical debt collection crisis and pass HB 565 to fight medical debt lawsuits and reform the dangerous collection practice of the hospital industry. I thank you for your time, and I'll turn it back over to Marceline.
Thank you so much, Kim. We appreciate your time. And thank you for highlighting the issue of people avoiding care because of fear of medical debt. We're also fortunate now to be joined by Dr. Richard Bruno, a family physician practicing in Baltimore City, who's also going to discuss from his perspective the importance of House Bill 565, the Medical Debt Protection Act.
Thanks so much, Marceline, and thanks to Delegate Charkoudian and all the coalition members here today and all the speakers, especially Nick and Ashley, who shared their personal stories. Very touching, and I really appreciate being able to hear your side of things. I work at a federally qualified health center in Baltimore, an underserved clinic where 30% of our patients are uninsured and another 40% have Medicaid and are underinsured. And I think essentially what we're saying and what we're hearing from all of you today is really how egregious these practices are from these hospitals who are really punishing people for getting sick and kicking them while they're down and really prolonging people's healing. We have good evidence to show that chronic stress, including financial stress, leads to problems with the immune system. We know it takes longer for people to heal when they're under chronic stress. It causes problems with the heart and with sleeping and with mood. All of these things compounding, making it more difficult for people to heal. So I want to join in these efforts and lend my support specifically for this bill that would end some of these egregious practices. I'll give you a quick story. I got a chance to go on tour in Canada and see the Canadian healthcare system and take a tour with Senator Bernie Sanders of some of the hospitals in Toronto. And one of the hospitals that we went to, we got to go and see the billing department, which was really just one person in the hospital who simply took payment for patients as they were leaving who had gotten extra services. Like, for example, if you wanted to watch cable from your hospital room, you would have to pay $14 a day extra. So that was what this person would do, would just take those small cash payments, because everything else was covered and people knew that it was covered. And we had a conversation with a gentleman who had come in for a heart procedure and had complications with that heart procedure and had to stay a couple extra weeks in the hospital. And Senator Sanders asked him what he was most looking forward to about going home. And he said, honestly, I think about all the people who live in America who don't live in a system where these bills are paid for. And I'm looking forward to going home and not having a mountain of hospital bills waiting for me when I get home. And that speaks, I think, to the importance of not burdening and saddling people with these additional stresses. So until we have a Medicare for all system or a single payer system where everybody has access to care and doesn't have to worry about these bills, we really need bills like this. And so we can protect our most vulnerable and under-resourced people in our state.
Thank you so much, Dr. Bruno. We appreciate that. Again, we all think this is an important first step in ensuring healthcare is affordable and certainly not burdensome and driving people deeper into poverty, deeper into debt, increasing and compounding their financial stress and their physical stress. So thank you for that. As you can see, healthcare professionals, um, people who represent workers, the NAACP, Progressive Maryland, the more than 40 organizations who have united under the End Medical Debt Maryland Coalition all agree that the Medical Debt Protection Act is the kind of legislation we need now to meet our health and wealth crisis post-COVID in the middle of a pandemic and recession. I also want to just take a minute to explain again that the provisions in the bill that Delegate Charkoudian proposed in the Medical Debt Protection Act are not are reasonable. This does not prohibit debt collection. It simply says you can't sue people. There's still all kinds of ways that hospitals can collect on the debt for bills that are $1,000 or less. Also, the solutions in this legislation are already enacted in other states. 4 states do not garnish wages at all. 9 states already protect the family home. 1 state does not garnish bank accounts. And in fact, 1/3 of Maryland hospitals today do not sue their patients for medical debt. All this bill does is create ways for other hospitals to follow suit for those who have debts $1,000 or less. I also want to highlight findings from our Gonzalez poll in October. This bill has wide, overwhelming bipartisan support. 64% of Maryland voters support prohibiting hospital lawsuits for medical debts of $1,000 or less. This is supported across Democrats, Republicans, and independents. They all see this as an issue of fairness. Secondly, there is overwhelming support across the board to create an income-based repayment program, a protection whose time has come. 93% of Maryland voters believe that hospitals should institute an income-based repayment program. And again, you can look at these numbers. This is across Democrats, Republicans, and unaffiliated. The time is now. There's broad support. This is an issue of fairness and equality that meets our moment and addresses the needs of Maryland households. Together, we urge the House Government and Operations Committee to pass House Bill 565, the Medical Debt Protection Act, and to do so with a clean bill without any weakening amendments. I want to thank everyone who has come together today to join us, the many, many members of the coalition who are watching or supporting today. And thank you all. We hope you will join us in helping to pass this act. And I would just want to pause and say we will take a few questions from the press if there are any questions right now. We're willing to entertain those from the press at this moment. And you can just raise your hand or place the questions in the chat. Thank you. Okay, I don't see any questions right now. We are all certainly happy to speak to reporters as well at a later time about this legislation. And the hearing is today at beginning at 1:30 in the House Government Operations Office.